All right, Vanessa, and we are ready to go.
Okay, good afternoon. Hello, everybody. My name is Vanessa Summers, and welcome to COVID-19 vaccine and the African American community in Indiana. We want to be able to address how African Americans deal with vaccines and whether or not the problems that we are having in our community with African Americans not wanting to take the vaccine. I would like to introduce our panel right now, and I'd like to welcome everybody to this great panel that we are going to have. First, we have Dr. Lana Diabo. She's an infectious disease physician at Indiana University Health, an assistant professor of clinical medicine and at IU School of Medicine. She serves as a medical director for infectious prevention at IU Methodist Hospital and director of vaccines initiative at Indiana University. She is currently completing her master's in public health with an emphasis on epidemiology at the Fairbanks School of Public Health. Welcome, Doctor. We also have Dr. Joseph L. Tucker Edmonds, an associate professor of religious studies, and African studies at IU School of Liberal Arts at IUPUI, and associate director of the Center for Study of Religion and American Culture. He currently serves as the president of the Indiana local branch of the Association for the Study of African American Life and History. Tucker Edmonds' new book, The Other Black Church, Alternative Christian Movement and the Struggle for Black Freedom, was published in December 2020. Welcome. Dr. Lauren Nephew is a transplant I should have spelled this out before I said it. Hepatologist, okay, at Indiana University Health and an assistant professor of medicine in the Division of Gastroenterology, yes, and hepatology at IU for medicine. In January 2021, she published an article in the Lancet about systemic racism and the outcoming her own and overcoming her own COVID vaccine history. You're too, I can hear you. We have finally, and least but not last, we have Alice Watson, is the vice president of operations and project management with the Indiana Black Expo. IBE is a year-round, multifaceted community service organization with 12 chapters around the state of Indiana. Alice is also the former deputy commissioner for the Indiana Department of Administration, Minority and Women-Owned Business Enterprise Division. Welcome everybody for this great discussion. We are going to start off with Dr. Diablo, trials, side effects, and common misconceptions with vaccines. Thank you for being here, and you have the floor.
Thank you very much for having me. Good morning, everyone. So yes, I'm going to talk a little bit about vaccines as an infectious disease physician and someone who is very interested in public health. I think vaccines have been our tool for many years to try to control the spread of infections that really cause a lot of harm and death around the world. So vaccines, I consider, are one of the best public health inventions that we've ever known to reduce disease and suffering in the world and prevent it. And that's why this topic is very dear to my heart. So before I talk about the COVID vaccines in particular, I just wanted to give an overview of how vaccines work and why they work the way they do. And it's important to know that infections, when they attack a body, they actually cause more harm in people who have never been exposed to that particular infectious agent. And that's why for coronavirus, it has caused so much problems across the world because our bodies are not trained to respond or fight against it because we've never seen it before. And because our bodies take a lot of time to start producing immune responses and antibodies to fight off the infection, oftentimes we lose people in the battle between the time when our bodies are ready to respond and when we are exposed to the infection. And what vaccines do is they ready our bodies to be able and capable of fighting off these infections if we are to be exposed to them. So they give us a lot of leeway in time so that we are fully prepared. Vaccines usually contain a portion of the virus. They do not contain the whole virus at all. So they are not capable of causing the infection, especially those COVID vaccines that we're going to be talking about. They contain a very harmless portion that in and of itself will not cause your body any damage, but it will allow your immune system, which are your soldiers in your body that help you fight infection, start being prepared. And it takes a few weeks to do that. So it's giving you some time to be fully ready for when the time comes, and if it comes, where you are exposed to the real virus, your body will remember that it was trained to fight against it. And what it will do, it will actually fight for you. And this is basically very simply how vaccines work. For vaccines usually undergo a lot of testing before they go into production and approval. And for these vaccines, the COVID vaccines that we're going to be talking about, they actually went through all of the clinical trials and the testing that was necessary to be able to prove that they work very well and they are safe and efficacious. And I know a lot of people have concerns about how fast these vaccines were developed. And I will say, yes, they were developed very fast. And that is a blessing that we have vaccines in such a short period of time. But the reason they were fast is not because corners were cut or steps were missed. Actually, we have scientific reports from every single one of the usual steps that all vaccines follow. And all of these requirements were fulfilled. The reason why it was fast is because usually it takes months to years, for those of you familiar with research, to actually recruit people to being involved in trials. These trials require a lot of commitment from people, sometimes for months, and people don't have that time, and they don't have the incentive sometimes. And sometimes we have to pay them, as you may know, to come and participate in trials. For this one, people just were very interested. There were thousands and thousands of people who just wanted to be part of trials to get us to where we are today. And that sped up the process significantly. Also, I want to emphasize that when you are not in a pandemic, it's very hard to establish if vaccines work or don't work because you don't have disease in the community. So it takes many years for us to be able to establish whether they work or not. For when you are testing vaccines in a pandemic, you have a lot of disease around you. So it's very easy to be able to say, okay, this vaccine works or it doesn't work. So these are one of the reasons why vaccines were developed fast. As far as the clinical trials themselves, they included a diverse population of participants. There were thousands, so around 40,000 individuals in each of these trials. There was representation between 20 to 30%, depending on what trial you're looking at, of non-white populations. And what these vaccine trials showed is that the vaccines were extremely effective at preventing COVID disease for all of the participants, regardless of their age, regardless of their racial or ethnic backgrounds. They also showed that these vaccines not only prevent disease, but they also prevent severe disease. They prevent you from getting hospitalized and from dying. So after vaccination, by 2 to 4 weeks, depending on obviously the type of vaccine you're taking, the risk of hospitalization and death from COVID went down to zero in all of those trials. So these are extremely highly effective vaccines that worked across all age groups, all people with comorbidities that were tested, as well as all racial and ethnic groups. And the last thing I want to talk about is we are starting to see safety data that even though the trials have established the safety of these vaccines, we are starting to see safety data from these vaccines after the trials in people like us who never participated in trials. Over 200 million individuals have gotten vaccines around the world. Over 2 million individuals have reported to the CDC some form of safety report. And this was all voluntary. I participated in that when I got mine. And the safety of the data was, these vaccines was confirmed even after the trials. So most of the time people will get pain at the site of injection or side effects like fevers, headaches, muscle aches that go away within 24 to 48 hours, but nothing serious, out of the ordinary, permanent, or irreversible has been at this point found out after all of these individuals have gotten the vaccine. So I just wanted to make that distinction that it's not only in the trials, it is also after the trials. And the trials also showed that these safety or side effects from the vaccines were very similar across all ages, again, all racial and ethnic groups. So again, very excited to talk about vaccines today because we not only have one and two, we have potentially a third one that will be approved this week that will help us get to where we need to be faster.
Thank you so much, Dr. DeBabo. We will have questions for you toward the end of our webinar. They're coming in. Next, we will have Dr. Tucker Edmonds. He's going to be talking about the history of vaccines and the reason for current mistrust of the vaccine. Thank you, Dr. Tucker Edmonds. Go right ahead.
Thank you so much. I'm going to share my screen, everyone. Good morning. Thank you, Representative Summers, for inviting us here for this opportunity and for the Indianapolis Medical Health Coalition. I really appreciate this opportunity. So I'm going to share my screen and I'm going to jump right into this presentation. I just want to make sure that everybody can see that. And we'll go from there. All right. So today what I want to talk a little bit about is who has the body, medical apartheid, racial malpractice, and a pandemic of mistreatment. And I am going to kind of go through this in about 10 or so minutes and kind of give you some historical background and allow for folks to think about where these issues of vaccine hesitancy emerge from and how we can think about them across time and across space to kind of move forward in response to them. So what my goals are for today is I'm going to define medical apartheid more broadly for you. I'm going to expose the continued model of racial discrimination as a form of malpractice. I'm going to outline a history of mistrust and abuse, especially in marginalized and racially vulnerable communities, and theorize a logic of continued suspicion and hesitancy. I called this presentation who has the body, because for those of us who are in the African-American community, we know that that is a typical question that is asked when African-Americans are going into systems or spaces, who has the body? And I wanted to kind of take that question and think about who can be trusted with the Black body, right? And how we think about the ways in which those questions shape and in many ways articulate the relationship that we're going here. So I wanted to define some key terms for all of you who have joined us this afternoon. First of all, I want us to think about medical apartheid, right? And this is social policies and practices alongside medical systems, services, and institutions that provide different and less equitable care and medical options to marginalized groups, right? So this is the broader category that we live in a medical apartheid system, that since African Americans have been in this country and have been experiencing medical care and medical treatment, we have been living under a medical apartheid system, right? Where there is less access to care, there is less quality of care, and the short and long-term outcomes are lesser and less efficacious for Black and brown folks, right? So this is a medical apartheid system. That's one term that I want us to understand. These other two terms are are related to a subcategory of medical apartheid. One is medical racism and scientific racism. These are the pseudoscientific, right? The unfactual, not true beliefs that empirical evidence exists to support or justify racism or racial inferiority or racial superiority, right? This is the idea that there were medical facts or scientific facts that supported the idea that Black folks were inferior, that Black folks were less intelligent, that Black folks had different kinds of skins or different kind of skull or cranial sizes, right? This is medical racism and scientific racism. And this is the idea that racist discourse impacts the logics of science and the delivery of medical care. And medical racism and scientific racism, even though it has begun to be disproven, right, and has been disproven over the last 70 or 80 years, it still organizes and shapes the medical apartheid system that we live in. And I'll talk about that when I look at some of the studies that support that. And then the last term that I want us to think about is racialized malpractice, right? And this is that the care of and the studies on Black and racialized bodies are marked by a blatant disregard of medical ethics and accepted quality of care standards, right? So this is the argument that even when we are using medical ethics and quality of care standards, that Black patients and Black and brown and poor patients do not receive the same kind of care, that those medical ethics are flouted, those quality of care standards are ignored, and therefore they are experiencing, as I argue, racial discrimination is understood as a form of medical malpractice, right? And we can look at what happened in 2020, but we can look at what's happened throughout the history of African Americans and their relationship to the medical system. So I want to go through relatively quickly a little bit of history, and I'm sure that many of you all already know this history, right? And so I want to kind of move through it in a way that will allow for you to kind of look at this, but also be able to move forward with it. If we look at it from the very beginning, Black folks' bodies were instrumentalized and were used to support the enslavement or the production or the creation of the medical system or the medical academic practice, but they were never used or were ever never taken care of in any particular way to protect their interests or to provide them safe and full care, right? From the beginning of our time here in the United States, from the enslavement auction blocks, doctors were there to inspect and to look at Black bodies in order to see if they were fit for labor and service and work. And even the early medical experimentation by J. Marion Sims, who was the president of the American Medical Association and was also the president of the Gynecological Association in the late 1800s, he did unconsented experiments on enslaved Black women and enslaved Black children. So from the very beginning, Black bodies were taken advantage of by medical practitioners, were experimented on, and were disregarded from the very beginning of our time here in this country. But as we move on, and then we just move forward just a couple of decades forward from Dr. Marion Sims, we look at Indiana as the birthplace of eugenics, right? And I want all of the folks here to know that we had one of the earliest eugenics laws in the country, right? Which allowed for the medical complex to selectively define who were the human races and the groups of people that were allowed to procreate or reproduce, right? It was an act that was created to prevent procreation of confirmed criminals, idiots, imbeciles, and rapists, right? This is 1907, folks, right? And this eugenics was what was really created the foundation and the birth of eugenics that was used in Nazi Germany, right? So right here in Indiana, we were the testing ground for eugenics that began to not only impact the ways in which we treated marginal and vulnerable communities, but this eugenics language was used to demonize and to very poorly treat Black and brown citizens at that time, right? Black parents were demonized. There was the increased incarceration and placement of Black folks in mental hospitals during this time, and Black women were forced to have sterilizations or the removal of their reproductive organs in order to create a system where we could selectively determine who was able to procreate. And there was even at this time in 1915s, the selective killing of Black infants that were seen to be defective and were thought of as going to be a problem in the continuing evolution of the human race, right? I want you to know that it was in 1908, as a result of these eugenic policies, that the first Black hospital was created here in Indianapolis, right? So we think about Lincoln Hospital in 1908, that was as a response to these practices and these projects that were limiting and denying the rights and the abilities of Black folks to get full care, right? Because Black physicians were not allowed to practice at these other hospitals. Lincoln Hospital created a space for them to do that, right? I'm gonna keep moving on. If we move forward in time, all of you know about the Tuskegee syphilis experiment, right? And so again, this Tuskegee syphilis trial and experiment was looking specifically at 1932 in Macon, Georgia, lied to 600 poor Black men who had syphilis, and the study looked at the progression of that disease, even though at about 5 and 10 years into the study, there was curable mechanisms of penicillin that could have been used. Public health officials at that time characterized these Black men as intellectually inferior, degenerate, and at the mercy of powerful sex drives. This is a quote from the public health officials in 1932. This language of pseudoscientific claims were used, right? That Black men were degenerate, that they were inferior, that they had these powerful sex drives, even though over 2/3 of the participants of the Tuskegee syphilis trial had non-venereal syphilis, right? So they did not have syphilis as a result of sexual encounters, right? And so again, these are the problems and the projects that emerge as a result of this. The participants and their families have never been fully compensated for their losses. There was a $10 million out-of-court settlement in 1975, and as a result of this trial, the Tuskegee syphilis trial, we created the National Research Act of 1974, right? So many of the doctors on our call will know that this is what created the Institutional Review Board, that you have to get consent for folks engaging in trials and things of that nature, that you cannot do trials to children or to prisoners and things of that nature, right? That people have to be able to consent. But this is, again, the long history of why African Americans and Black folks are very questioning and concerned about this, right? I have 2 more slides that I want to get to, folks, right? Stolen bodies and stolen futures. These are images, again, of the ways, even after the Tuskegee syphilis trials, that we see that this went on throughout time and history, right? Throughout the late 19th century and the early 20th century, medical schools in Baltimore, Alexandria, Norfolk, and Richmond, and throughout the country were stealing Black bodies from graveyards, graveyards, to do medical experiments and treatments, right? To test these things out. Again, you have the picture in the middle of Henrietta Lacks, whose cells were used without consent and were taken unknowingly and harvested for decades of medical research, right? That played out, right? And then on the right of my slide, you have the sterilization of women, and Black women particularly. By 1940, you all, over 100,000 women had been unlawfully sterilized, with the majority of them being Black and brown women in this country, right? So we have a sense, again, of why there is this vaccine hesitancy, why there are these questions about how they have been applied to Black and brown communities, and why we have a real question about who can be trusted with the Black body. On this last slide, I wanted to just look at that there is a continued pandemic of mistreatment, right? And so the reason that we are having this conversation today is because these are not just stories of a historical medical apartheid or historical racial malpractice. These are issues that persist into our current moment, right? The unethical experiments on Black prisoners, Black and brown prisoners. There was a study done in 2000 by the University of Texas. There was another study done by Stanford in 2007 that many of the medical experiments in prisons across this country are being done without consent and are not not following that 1974 IRB law that was created in light of the Tuskegee syphilis trial, right? So that's prisoners, Black and brown prisoners. We all know about the 2016 study that was done on pain around Black and brown folks, that in this study that half of the trainees and the folks that were surveyed in this study still felt that Blacks had thicker skin than white people, Black people's nerve endings were less sensitive than white folks, and things of that nature. And then finally, in 2018, there was another study that shows that we are living in really medical deserts, right? Where folks do not even have access to culturally competent care, that they cannot find doctors that will give them care, that speak their language, that understand the racial and ethnic issues that they are facing. And so all of this, folks, and I know I'm out of time, creates the conditions under which African Americans and Black folks have a sense of hesitancy. And so we need to read this hesitancy within the large frame of what has happened over the course of the last 200 years of African Americans and their relationship to the medical industrial complex. And therefore, we have a responsibility to give them the most up-to-date information. We have a responsibility to confirm with them that they're going to get safe and thoughtful care, and to provide them the knowing information and full information that they can use as they decide which vaccine to use and how to apply it in their lives. These are the questions and the issues that we're facing right now. And I hope that as we talk this afternoon, that we can continue to look at how we overcome these historical issues and move forward with the distribution of the vaccine.
Dr. Tucker Evans, that was phenomenal. Thank you so much for all of that information. And I think that all of us can understand where the hesitancy of the African American community comes from as far as vaccines go. Oh my God, that was a phenomenal presentation. And I'm sure in the question and answer section, we will have plenty of things to talk about. Now we are going to go to Dr. Nephew. You're going to talk about the COVID disparities as well as your own journey to overcome the mistrust.
Yes, thank you so much for having me. I'm really grateful to be here to discuss this important topic. I am a liver transplant doctor, so this is a bit of a different space for me, but I am a health disparities researcher, and I'm an epidemiologist. And in addition to those hats, I am a Black woman, and I am a mother, and I am a wife. And I wear all of those hats when I am making decisions. And I'll jump to the end of the story and say, ultimately, I did get both COVID-19 vaccines. But it was not without a lot of deliberation. And I've moved from saying hesitancy to deliberation because it was a lot of thought that had to go into that. And I was lucky enough to be asked to kind of write about what I thought about people of color and our thoughts around getting the COVID-19 vaccine. And I was really honored to have the opportunity because there were a few points that I wanted to make that I'll share with you today. One of the points that I wanted to address was this idea that if you wanted to deliberate about the vaccine, if you had any hesitancy, that it was because you were uneducated or it was because you were uninformed. There seemed to be this narrative that that would really be the only reason that you wouldn't want to move forward with the vaccine. And so I really wanted to take the opportunity to share with a medical audience that no, I was talking to my family, my friends, to other Black physicians, and many of us had concerns around the vaccine, and many of us are quite frankly overeducated. And so this was not a symptom of lack of education or lack necessarily of information. The second point that I really wanted to address was this idea that COVID-19 disparities were somehow Black and brown people's faults, that if we were less obese and if we had less diabetes, then maybe we wouldn't get so much COVID-19. And I said, wait a minute, you have to really think about this in the context of structural racism. You have to step back and say, what really led to obesity and diabetes in our populations? And so structural racism are really the policies and norms that have been going on in our country for hundreds of years that have led to poverty and unequal access to jobs and the inability to get good educations in public school. those things have consequences. They trickle down and cause social need, where people don't have enough money to buy healthy food, where people don't have time to go exercise, they need to work, where people don't live close enough to a place where they can exercise. And those things have consequences, which include obesity and hypertension and diabetes. And so this idea that somehow these things just popped up out of the blue in Black folks and brown folks, and that they weren't a consequence of 100 or more years of policies and laws that had been set in place was really problematic for me. And so there's nothing inherent about Indigenous people, Black people, or Asian Pacific Islander people that would give them COVID, right? There's these comorbidities that are really a symptom of systemic racism and structural racism in our country. And so I really took the opportunity to kind of share some of those ideas with the medical community, because I felt that there was a narrative that was being missed. Um, in addition to that, I really wanted to speak to my own journey and my own kind of path to deciding to get to vaccine. I'm a physician and a scientist. And so the idea is that, I know all about health disparities, and I know about health disparities in Indiana. Indiana, overall, our health is a bit poorer than the rest of the nation. We rank 38th out of 50 states in terms of our health. And so that's everybody. That's not just Black and brown people, that's all Hoosiers. And so overall, Indiana struggles with health. And then if you take healthcare disparities, and we're already 38th in the country, healthcare disparities are disproportionately impacting people of color here in Indiana. And so when you look at rates of obesity and smoking, maternal fetal mortality, liver cancer, the cancer that I study, we're dying at higher rates. And so it wasn't surprising for me when COVID hit Indianapolis to find out that Black patients are dying at twice the rate of Asian and white patients, because this is something that's been going on in Indiana for some time. And it's not unique to Indiana. Many of you know that this disparity in COVID-19 survival is a problem across the country. It's been really a disaster. 1 in 645 Black people have died from COVID. 1 in 645. That is impressive and scary and awful. Over 63,000 Black people have died from COVID. And so this is going to have long-standing consequences on our families, on our family units, on our abilities to build wealth. It's going to impact the generation. And so I knew all of this, right? I study this. This is what I do every day. This is what I write about. And I still had vaccine hesitancy. I still was nervous about getting this vaccine. The people that I talked to, my colleagues of color, we were concerned. And I had to sit back and reflect and say, why is this? How could you know all of this, Lauren? How could you have over 10 years of medical training and still be hesitant? And it really boils down to the fact that I am still a Black woman. And I still came up and was raised and trained in this culture that Dr. Tucker Edmonds just talked about, this culture of structural and systemic racism. And I didn't have to look back as far as Tuskegee. I could talk to you about my own experience in the hospital giving birth, where I was discriminated against. I could tell you about times where I had to call the hospital and advocate on my mother and my sister and my cousin's behalf and pull the doctor card because they were being mistreated. So I didn't have to reach back 20 years. I could talk to you about my own experience with healthcare, my own experience trying to process Dr. Susan Moore's death. And so when you look at the things that are happening now, not historically, right now, it was reasonable for me, I thought, to have this hesitancy. And so how did I overcome it? For me, it was getting information that, like Dr. DeBabo gave me, understanding it for myself. I read all the trials because I'm a scientist. I looked at all the tables, and then finding people that I trusted, infectious disease doctors of color. I talked to them, I called them up. What do you think? So finding trusted messengers to try to figure out, hey, what do you think about this vaccine? I thought about the consequences of not getting it. I always said, well, I get all vaccines. I'll eventually get this one. But no, I needed to get it now because time is of the essence and people are dying every day. 1 in 646 people, and I couldn't be one of those people. And so after some deep research and reflection, I was really kind of able to overcome my hesitancy and kind of move from a maybe later to a let me get this now. And so I'm hopeful that we can provide some information to help you move from a never or a maybe later to you're ready to perhaps consider getting this now. And I hope that we can validate your concerns if you have them. And if you don't have them, we can help you reach out to some other folks in your family and your social network.
Oh, Dr. Nephew, that was absolutely powerful, especially the part, we want to discuss with you probably at a later date about the maternal mortality and your personal experience with that. That is one of the things that Indiana Minority Health Coalition are trying to change the numbers of African American women that are dying from just being pregnant. We want to be able to move that that needle. So hopefully we will be able to talk to you. And now, Miss Alice, you're going to talk about COVID economic impact on the Black businesses and community. So what do you have? What say you?
Well, thank you, Representative Summers, for that introduction, and thank you for all the work that you do and your passion with the caucus. Also, I know this is not the appropriate time, but I do want to tell you that we certainly respect what is going on, and we're 100% behind you. I'd like to share my screen if I can here. Just give me one moment. See if I can find the right thing here. One of the things that I appreciated being included on such an esteemed panelist of experts on the health side, but I think we would all be remiss if we didn't talk about what's going on with our community also on the side of the economics, if you will. And I need to see if I can move this screen along. What we did here at Indiana Black Expo last year is we partnered with the state. The governor had an initiative called the Restart Initiative that the intent was to help minority businesses have access to additional funding, specifically small minority businesses. Our role was to work with those smaller Black businesses across the state of Indiana to raise awareness of the resources and the financial, there was grant funding that the governor offered to those businesses that would help them during the pandemic. As we know, with all spectrums, Black individuals, Black businesses are just disproportionately impacted by this pandemic. So we partnered with Engaging Solutions and our 11 chapter affiliates to help with providing information and resources that were out there through the governor's Restart Fund. Some of the things that we worked with is doing marketing, community outreach, and also surveying business owners while trying to create a database of small businesses and tracking to figure out what were their needs. We know that the most important need was financial resources to help them from a sustainability standpoint, but also other resources that potentially they aren't usually exposed to that might be out there to them, such as technical assistance, training, supporting startup businesses. Also, one of the things that we did is we did webinars. Of course, we pivoted as an organization ourselves virtually, but providing webinars with panelists who focused on resources for minority businesses, helping startup businesses during the pandemic. One of our concerns with trying to help startup businesses is we didn't want to send them into a rabbit hole, right? I mean, this is a very difficult time. And so, we were tasked with searching out entrepreneurs, helping them to get started. And we were very, very concerned with that as an organization, that it's okay to help a business get started. But once we help you get started, what is it that the state is doing to help them to continue, especially during the pandemic? So we kind of slow walked that initiative, if you will, and focus more on helping existing Black businesses from a sustainability standpoint. What we found is we did a series of webinars, and we did an outreach effort for our webinars of over 300,000 businesses. We had approximately 1,400 businesses who actually attended our webinars for the year. We had close to 2,700 who actually registered for those webinars. And again, the webinars were focused on financial management, other access to capital, because the other thing that we found with the Governor's Restart Initiative is they hit the wall before they could get through the wall. And a lot of that was because of some of the criteria that wasn't conducive to our businesses. So the funds that quite frankly are still sitting out there, not sure what's going on with them, but I know that our businesses didn't have the opportunity to access a lot of that funding that the Governor's Restart Initiative offered. We had, again, 11 of our chapters who worked across the state. We have chapter cities in Evansville, Fort Wayne, Gary, Anderson, Indianapolis, Kokomo. And again, those businesses, because they knew where Black businesses were located, and believe you me, there are a lot of Black businesses out here in the state of Indiana. We may not know about them, but they are there and they need tons and tons of help and assistance and resources. And it's not necessarily happening. A lot of that is through lack of knowledge, quite frankly, and lack of awareness of what is out there in the community. Again, through the partnership with Engaging Solutions, we reached over 1,800 businesses. 945 of those businesses completed the surveys that were initiated. Some of the challenges that we found with our businesses were, number one, there's a reluctancy. Again, I mean, it's no different than what we're hearing when we talk about the vaccination. A lot of our businesses don't trust government to share their information. That could be just historical, that could be from personal experience, but they just don't. So a lot of times they're not necessarily willing to give up their financial information for potential funding opportunities that might exist out there. Again, the governor's grant criteria just did not fit our businesses. The profitability issue was a major sticking point. Again, it's like, one of the requirements is that you have to be profitable. We have a lot of our small businesses, our sole proprietors, they didn't enter the pandemic profitable. They actually were struggling, if you will, initially, even before it hit. And so when it hit, it became even more difficult for them to access funding opportunities that might have been out there. So again, the whole application process for our businesses was just too rigid and too difficult for them to have access to those fundings. There were also issues with just having the electronic capability of uploading documents. Some of the things that we found through, there's always a SWOT analysis, and it's like whatever challenges or opportunities, some of the things that we found is what we were able to do is reach a significant amount of businesses that we might not have otherwise been able to reach and educate them about resources that are out there. There are a lot of resources out there for businesses. It's just our people don't necessarily know about them. So we took this opportunity to connect them with the Small Business Development Center, who provides a lot of other services other than just funding opportunities. Some of the things that we found that our businesses, through the survey, that said that they needed is they needed assistance with signage. They needed assistance with becoming certified and understanding what does certification mean. How would that help them with their business? They needed assistance with communications, websites, virtual outreach efforts, business development. They needed assistance with equipment. And again, these are things that even prior to the pandemic, we know that our businesses need in the community. Technology, access to the ability to secure property, leasing support, upgrading again their website. So the list just went on and on and on about additional resources that are needed out there across the state of Indiana for our small businesses. What this did confirm to us is that there is a greater need than ever before because of the pandemic for our minority community. The outreach that we did, again, to help to inform them on those resources needs to continue. This will not go away. This pandemic and the impact that it has on our business and our community. And so we will continue to actually do that work, whether we partner or not partner, again, with our 11 chapters across the city. That it gave them the opportunity to connect with the businesses, to figure out what are the resources that are needed. It also helped us to mind our community. What we know about Black businesses and small businesses is they're the engine that drive the economy. They also are the engines that employ our own, and that if we can't figure out a solution of how to help them to sustain themselves, then our economy will not recover in the communities that are the most disadvantaged, underserved, and disproportionately impacted by not just this pandemic, but any disease. So again, I know we're kind of out of the realm of the vaccination and the things that you're discussing today, but I think it's very, very critical and very important that we would be remiss if we didn't address what's going on in our community as it relates to our Black businesses that are out there, and figure out a way to help them to sustain and grow. Thank you for your opportunity.
Thank you so much, Ms. Alice. I do believe that we can see where it all is one circle and we're all in it together, and businesses need to be taken care of, just like our personal health. Our personal businesses need to be taken care of, and we need to be able to know where those businesses are and help them in this recovery stage. One thing that I wanted to stop and do right now is to talk about that. We're going to go back to vaccines, and we're going to go back to the eligibility right now. We know that now anyone that is 60 years or older can get the vaccine. Woohoo! I'm now eligible to get the vaccine. If you work or volunteer in healthcare and have face-to-face contact with patients, that includes all clinic, non-clinical positions, such as dietary positions and administrators, etc., or can now get the vaccine. If you have exposure to COVID-19 infectious material, for example, those who clean the rooms of COVID patients, you are now eligible. If you're a first responder who is regularly called to the scene of an emergency to give medical aid, such as a firefighter and police officer, you're eligible. This information and more, including registration for vaccinations, can be found at the Indiana State Department of Health website. If you are eligible for the vaccine and you would need assistance registering, you can call 211. Now, I'm going to go into, my personal experience with COVID. In about the week of December the 17th, I continued to have a fever. And I kept saying, oh God, that's what this is. So I went to Eskenazi on the 17th. And I was sitting there, when you sit there, you have on your mask, and then they have you put on another mask. So I was in there with two masks, and one of the nurses looked at me and said, come here, you're having difficulty breathing. Well, I just thought I was having difficulty breathing because I had two masks on. Come to find out, I had a condition called hypoxia, which is no oxygen to your inner organs. So I went into the hospital, into intensive care. Only problem I had is that my oxygen level was bad. So I started getting 90% O2, and I was in ICU for 11 days getting that O2, and I had to go from 90% to 35% to get out of ICU. Then I was in a regular room for about 7 days, and I had to get from 35% to 4% oxygen to get out of the hospital. So I missed Christmas and New Year's. Both were spent in Eskenazi Health. I still am on oxygen now. So I believe that once you have COVID, whatever your issue was, whatever the problem was, you kind of still have that. You saw me on oxygen at the beginning of the webinar. So I'm doing a whole lot better. I don't have to be on it continuously. I've been able to, break myself down in certain times that I would need the oxygen. But like late at night, like at night when the sun goes down, you know how you get sicker when the sun goes down. Well, it goes for those that I believe have COVID and maybe have some sort of condition. Because every evening I usually have to put my oxygen on because I'm feeling a little winded. But we're working on it. I've got pulmonary doctors, and so I'm considered, I guess, a long hauler. But I'm also cannot get the vaccine for 90 days. So got out of the hospital on January the 3rd. So sometime in April, I'll be able to get the vaccine, and I will be going to get the vaccine because I think being in the hospital, not being able to see your family, I have one son that I went to the hospital. He dropped me off to the hospital to see what was going on, and I didn't come home for 18 days. So it was a bit much. And I believe in and the thing is that I believed in wearing my mask. I didn't go out very often. I didn't go to very many places. There's only 2 places I can identify that it may have happened. I went to a funeral and I went and got my hair cut. That was it. That's the only thing I ever did. I have truly been in the house since March, since last March. So make sure you are wearing your mask, and make sure you are social distancing, and make sure you are washing your hands, because I thought I was being careful. So I cannot tell you where it happened. But we have questions, and I think the first question is going to be for Dr. DeBabo. What is the effectiveness of the first shot? Is the first question.
So the first shot of the Pfizer vaccine is around 50% effective, meaning that you are protected 50% of the time, which is still great. Remember that the effectiveness of the vaccine doesn't start right after your shot, but it takes 7 to 10 days to actually start building up your immunity. So after those 7 to 10 days from your first shot, you will be protected by 50% potentially from COVID. However, the Moderna and Pfizer were not studied with just 1 dose of the vaccine. So we don't know if you got that 1 dose, whether that 50% protection will last long enough or whether it will go down. So we still recommend that you get your second shot to get to that 90% that will potentially last you for longer.
So that's when we see people that have had their first shot, but then still come down with COVID.
Right, because the first shot is not as preventative as getting both shots. So you can still get COVID between the first dose of the vaccine and until 2 weeks after your second shot. This is still a period of time where your body hasn't built up enough immunity to help you fight against COVID. 2 weeks after your second dose is when we start talking about that 95% efficacy in preventing COVID. Again, nothing is zero in life, but this is, I think, the best we could ever hope for a vaccine with 95% effectiveness.
If anybody, any of our other panelists have anything else to say on any of the questions, don't hesitate to come in. How effective is the Pfizer vaccine on the new variant strains? Or I guess Pfizer or all of them on the new variant? What goes on with, what happens with, we get one of the other shots and then they say that there's a new variant? How safe are we?
Great question. So the Pfizer and Moderna vaccines seem to be maintaining their efficacy with the UK variant. What they did is they took blood from individuals who had the vaccine, and they tried to see whether it would, effectively get rid of the UK variant, and it seems like it will work. The one that might be iffy is the South African variant of COVID. There is lower antibody response potentially with that, although it might not be low enough to the point where we are considered non-immune to that variant. Only time will tell. When they did those studies, we didn't have any of those variants. So right now, all we're doing is we're doing lab work to try to verify whether those vaccines work against the variants. Our preliminary data suggests that they potentially do, Pfizer and Moderna, but we need to follow up with time and make sure that people who are vaccinated don't get infected with those South African strains. That's why we are saying for vaccinated people, up until we have more information, we need to continue to distance and wear masks so that we are prevented from getting potentially other variants that may not be, that your vaccine might not work against. So these are important to keep in mind. Also, that variants continue to happen over time, so we might come against new ones as well. That doesn't mean that these vaccines don't work. So there's a distinction here. The vaccines still work great against the coronavirus that has caused all of that death in this year. So you still need those vaccines, but whether we need to add more boosters for the variants is still a question.
I'm going to give you a question for the panel off of the chat. I was wondering about your familiarity with age difference in concerns about vaccines. Have you seen that groups against vaccination target African Americans in the U.S., particularly on social media? Can anyone talk about that? I guess they're asking, do you think that the anti-vaxxers are targeting African Americans in the U.S., particularly using social media to not get the vaccine?
I'm not sure about that specifically, but I will say that when the Kaiser Foundation did their study to look at vaccine hesitancy in the community, 70% of Black Americans wanted to get the vaccine and didn't have any hesitancy. And vaccine hesitancy was higher in Black patients than white patients, but it was only still about 30%. And it was highest among Republicans. And this isn't about being partisan, but this is about just making it clear that Black patients and Black persons aren't a monolith. We are certainly all different. And most Black people want to get the vaccine. And so this idea that there's this large kind of swath of Black people who are hesitant about getting the vaccine is not exactly true. Yes, there are slightly more Black patients who are hesitant to get the vaccine than white patients, but in general, most Black patients are ready and willing. They just have to have access. They have to be able to get to it. They have to be able to register. They have to be able to figure out how to get it. And so I think that in some ways we may have been targeted a bit as the group that's hesitant, but there are other groups that are hesitant as well. And the majority of Black people, when surveyed, want to get the vaccine, and that number is increasing when they surveyed in December and then when they resurveyed in January. So I think, that's a point to be made.
Yeah, I totally agree, Dr. Nephew, that one of the other points to be made is this question of like, now how do we actually get access? This question of that I was talking about, like with the medical apartheid, there's the question of now, if Black folks and brown and Black communities are saying, we want this vaccine, we need it, now we've got to figure out how do we get through this Byzantine system? How do we get people to log on? Do they have internet access? Are there doctors and places that they feel safe to go to that can give them the vaccine? And I think that's what we have to do as a community here to not only dispel any inaccurate myths, and I think that Dr. DeBebo is doing a great job of doing that, but also now direct our community to places and physicians and systems where they can safely and really in a trustworthy fashion receive the vaccine and make sure that their care after they receive the vaccine is adequate and excellent in all areas.
I have another question here. Do you advise to get the shot if you have never been tested to ensure you don't have COVID, as you might be an atypical carrier? Anybody?
I can take that if you want. So yes, you don't really need to be tested. You can get the vaccine, even if you've recently recovered from COVID. Actually, when the studies were done, some people had recovered from COVID already. And the effectiveness of this vaccine is very similar, and you will not be harmed if, let's say, you were a carrier, you didn't know about it, and you got the vaccine. It will not harm you. So I would say, we don't want to put more barriers to people getting vaccinated, so you really don't need to be tested first.
Okay, I have another question about, now this is a long question, and I think I probably need to read it instead of trying to piece it. Okay, I received only one flu vaccine in late 90s, and I didn't like the extreme fatigue I experienced for 72 hours. At time of my flu vaccine, I was in my 40s and had no other health problems. This is the cause of my hesitation of getting the COVID vaccine. I have taken precautions against the flu and only had the flu once in the past 20 years. What is your thoughts on considering I'm avoiding getting the flu without a vaccine, so can I apply the same precautions to avoid COVID without the vaccine? And I guess I would answer that is I thought I had done all the precautions too, washing my hands, having a mask on. I went to one funeral and we were all socially distanced, and I still got COVID and ended up in the hospital for 18 days. So I'm looking for April to be able to get my my COVID shot. Dr. Nephew, you have?
I would just agree with you that many people took precautions and still got the vaccine. And unfortunately, the repercussions of getting COVID can be death, even in people without comorbidity. And then people can have really protracted recoveries. I had a cousin who got COVID. She was in the hospital and she was in the ICU for many days, and she had to get out and do physical therapy to learn to walk again. She was very, very sick. And she's a young person. And so you don't know how COVID is going to affect you. You don't know what the long-term sequelae are going to be. Most people recover quite well from the flu. We've been seeing a lot of post-COVID syndrome and a lot of kind of lingering symptoms. And I just think that when the risks are so high, that it's worth it to protect yourself, even if that means you're going to feel a little under the weather for 2 days. I got the second vaccine that had no symptoms and other than a sore arm. And I was actually a little worried. I said, oh my goodness, is it working? Do I need to get another one? Maybe I should get a third one. I actually wanted to feel my immune system and know that it was doing its job and know that it was making those antibodies so that I could feel a little bit better about being out here in this world. So feeling your immune system revving up and doing its job, it's a little unpleasant for 2 days, but it's a good thing. It's how you know that you are, your body's doing its job. And like I said, I was a little concerned that I only got a sore arm. And so I think it's worth it.
I think it's worth it too. I cannot wait till, I had to wait 90 days, like I said. So looking forward to that, because I'm in the slot now where I could go get one, but, of course they said to wait. And the last question that I have here on the question and answer is, do we know what the trial statistics are on the Johnson & Johnson vaccine? Does anyone know that?
I'm happy to take that. So the Johnson & Johnson vaccine is just being submitted to the FDA, and the results are very, very promising. So in the media, you will hear that number 60% or 70% vaccine effectiveness, which it makes people think, okay, maybe it's not as good of a vaccine as the other ones. Actually, if you dig deep into the data, you notice that the effectiveness of the vaccine against preventing from severe disease is actually 85%. And after 4 weeks of the vaccination, you have no one in the trial who ever had to be hospitalized, had to receive medical care for COVID, or died from COVID. So from a vaccine effectiveness perspective, if you lump everyone in that group together, it was 66%. But when you talk about vaccine effectiveness against preventing severe disease, hospitalization, and death, it's actually really much higher. The reason why the overall effectiveness is 66% is that this vaccine was studied in the US, in Latin America, and in South Africa. In South Africa, there was this South African strain that was predominant that showed somewhat of a less overall effectiveness of the vaccine against getting disease. But still, in South Africa, even when you get this vaccine, even if you're getting more mild cases, you are still 85% protected against severe disease and 100% protected against death and hospitalization, which is exactly what we want, right? We don't want people to go to the hospital. We don't want people to die. If they get a mild disease, because it's still possible to get it with Pfizer, Moderna, and Johnson & Johnson, that is an acceptable risk, because vaccines will never be 100% protected, and actually nothing is. But the severe outcomes are much higher than that.
Just another question just came across. How long are the vaccines effective? Do we know how long it would be? Anybody?
Do you want me to?
Yeah.
Okay, so how long is a great question. We only know how long they last as long as they've been studied. So right now, the clinical trials ended around 3 or 4 months ago. And so far no one has reported that people have been started to have reinfections after the vaccination. So right now, we know that they last at least the first 90 days after the vaccination. I anticipate that they would last longer, but we don't have that data yet. We're waiting on more time to pass for those individuals to know when, if any, they will get reinfected.
And another one is, do we know of any long-term side effects from getting the vaccine other than the sore arm, or maybe feeling bad for a couple of days? Is that the only 2 things that we know that'll happen so far? Yes.
Yes. So actually, the side effects are very transient. Sore arm is the most common. I had that when I got mine. Fever, chills, body aches, like I said, headaches. They are reversible. They happen 24. They resolve within 24 hours after, and they just indicate that your immune system is working. There was a question about allergic reactions, so I'll also use that as an opportunity to talk about it. Allergic reactions happen with all drugs, medications, vaccines. Anything that you take has a risk of allergic reactions. Anaphylaxis is the one that was initially reported, which is the very severe allergic reaction that requires medical attention. Initially, there was a lot of coverage on it, but when we looked at the millions of people who got the vaccine, the rate of it is of the order of 2 to 5 per million individuals who got this severe allergic reaction. This is 10 times lower than penicillin. So actually, we take more risky medications in terms of anaphylaxis, but regardless of that, everyone will be monitored in the clinics for 15 to 30 minutes to make sure that these reactions don't occur. They usually happen in the first 30 minutes after your dose. If they didn't happen after 30 minutes, they won't happen afterwards. Other long-term side effects have not been reported, and everything has been reversible so far.
We are almost at our closing time. I would like for all of the participants to know that we have a brief survey for this event, and we would really appreciate if you would fill that out. The link to complete the survey can be found in the chat. And please stay tuned for further events. Do any of our panelists have any closing remarks? Dr. DeBabo, would you like to say something? And then we'll go to Dr. Tucker Edmonds and finally to Dr. Nephews and Ms. Alice.
So I'll say real quick that, always consider that if you have questions about vaccines, that's not a bad thing. Please reach out to doctors or people you trust. If someone asks you about and they're concerned about vaccine side effects, also respond to them with a lot of understanding and acceptance that, different people are at different stages of their hesitancy or acceptance of the vaccine. And it's okay to be worried. It's okay to have questions. So just try to go to trusted sources of information if you have questions. And we're more than happy to address that as physicians, as clinicians, as people in the community. So just know that these are valid questions.
Thank you.
Yes, I would just want to concur with that and say that, I saw one of the comments said, I've already received my second Pfizer vaccine. What can I do to assist with advocating for the vaccine, right? And I think that what we can do is that we can continue to talk about our positive experiences with this, but we can also normalize, I think what Dr. Nephew said was exactly on point, that we can normalize that we want to be deliberate and thoughtful, that there is a historical kind of concern that I went over, but then also Dr. Nephew very powerfully articulated that there's a contemporary concern that still exists amongst Black and brown communities and amongst poor folks. And so what we're saying today is that it's okay to have questions. Ask those questions, reach out to your trusted physicians and practitioners, and also encourage other folks that have had good conversations to share them on social media, to share them at their churches or in their other places of community, so that we can tell these stories, that we can share what has happened, and that we can and use them to really push this forward, and that we can get people vaccinated in a timely and a safe fashion. And I think those same stories about moving from hesitancy to deliberation to ultimately taking the vaccine are important, but also how you even navigated the system. We need to hear those stories. If there are any issues, talk to your politicians, Representative Summers, if you're having issues, so that folks can get those answers and get to trusted physicians and get the vaccine if they feel that that's what's best for them.
Dr. Nephew.
I would really just echo everything that's already been said. I see a question in the chat that says, has anyone had success convincing their friends and family to get the vaccine, and what worked? And I think we are all gathering information, and we all become trusted messengers. Everybody who's now been in this panel has learned something that they can take out to their family and friends and help to communicate with them why getting the vaccine may be important. And I think one of the most important things you can do when trying to kind of convince people is listen. What is their why? And don't try to just dispel what they're saying from the beginning. Why don't they want to get the vaccine? Listen to what they're saying, and then provide them with some of the information you've learned today. I had success convincing my 87-year-old grandmother. Anybody can be convinced. She is set in her ways.
That age group,
And so I would say that that just take what you learned today and listen to their why.
Ms. Alice, our final word.
I would echo what everyone has said. I will say that I had my shot 2 days ago. I've never been so happy being 60. But also think about your loved ones. I mean, I have a mom who's in a facility here, and I look forward to being able to see her again. It's been almost a year, so really think about the fact that you can start to live again. And I think the most powerful message is just being a testimony to our folks to say that I've done it, and and I'm okay. And then I would like to remind everyone to please go out and support our Black businesses. They are struggling. Again, I think we should take a shot for them also, so that they can open their doors and start to grow again. So let's not neglect that they're out there, and make sure you patronize them and help them as much as you can to provide resources so that they can survive this pandemic.
Oh my God, this has been a phenomenal webinar. Thank you so much to each of you and for each of your expertise that you bring to the table. This has been phenomenal. And we will be able to repeat this on our YouTube channel, so you'll be able to see this. I want to thank all the attendees for tuning in on Facebook. And a very special thanks goes out to, of course, our wonderful panelists, Indiana Black Expo, the Urban League, and NAACP. I really thank everybody. And all I can say is, that's all, folks. Thank you so much. Bye, everybody.
Bye-bye.
Thank you. Bye-bye.